Good day, global citizens. Welcome to another episode of the Tufajembala's Opinion. This is a platform where research meets understanding and legacy. I know on this platform we've discussed different types of medicinal plants, and today we will discuss another medicinal plant, which is Moringa. Moringa is a widely used medicinal plant globally, well known and well acknowledged medicinal plant globally. And in Nigeria, we use it for many things. I've seen moringa juice, I've seen moringa salad, different things that moringa is used for. So today, basically, we are going to look at the relationship between moringa and urinary tract infection. I know urinary tract infection is a household discussion. Everywhere people are talking about urinary tract infection. So we'll know more about, not just more about urinary tract infection today, but we'll know its relationship with moringa, how moringa helps in its management. This is an interesting research when I first saw it, and I can't wait to learn as you also learn from our guest researcher today. So please do me the honor of welcoming Mr. Osheku Isiaka Zakari. Welcome, sir.
Thank you very much, Azizat. It's my pleasure.
On the hand or the skin on the foot. So, Mr. Osheku, what is the beginning and the end of the urinary tract? I feel people should know the beginning and the end of it.
Okay, first of all, urinary tract infection. This is an infection that affects the urinary tract. So we need to look at what are the components of the urinary tract. First, the anus, maybe for a female now into the vaginal opening, you can self-contaminate yourself. So children, they are not mindful of hygiene. You can see that's where the impact of age has to do with UTI, because they're not mindful of hygiene. So that's more reason why they have cases of UTI among children, because a child wouldn't know what to do. He doesn't know about hand hygiene in most cases, especially those that are below 5 years and all of that. And if you also look at it in the area of those that are older, by the time you are older, some people have some terminal disease like diabetes. By the time you have diabetes, you are prone to having UTI because your immune system might not be strong. If you have a weakened immune system as a result of old age, you can have UTI. And also, there are people that cannot produce urine easily, probably because of enlargement of the prostate. So they don't empty urine properly, and their inability to empty urine allows the urine to stay in the bladder and also give room for bacteria proliferation.
At the beginning, we mentioned that we're talking about the relationship between moringa and UTI. Many people know many things about moringa, but not every information that is going on in the community is right about moringa. What are the 3 myths about moringa you've come across?
What are the what?
3 myths about moringa you've come across.
Okay, I think the major one, we know moringa. The major one is the myth. Moringa can cure all diseases. There are a lot of people that think moringa can cure the incurable. That doesn't mean it's a miracle tree. Know that that's the popular name that's being called. So people just feel miraculously moringa can cure all diseases. That's not true. Moringa cannot cure all diseases. Though it has some medicinal properties, but cannot replace clinical treatment. So even though it has a lot of antimicrobial activity, anti-inflammatory activity, antipyretic, and even anti-ulcer, but however, that should be, it's not to say it's going to replace clinical treatment. Clinical treatment is still very much required. So secondly, the second myth associated with moringa, people believe that those who consume moringa more, let me see. People believe that the more moringa consumed, the better the health benefits. That's a myth. It's not always the case. And the reality is that it may even support